One of the things that I've been thinking about is how do you have transitional policy that keeps us, you know, hold harmless or as is type of, and at the same time moves you away from that, slowly weans you away from that into a new kind of policy. And I don't know if anybody's written about it, thought about it that
Give
way.
me an example. What are you talking about?
Well, for example, if you think about health care and you think maybe this is a foot in the door in the sense of, let's say we have the uninsured and we want to take care of the uninsured, but we have employer-based health care, we've got Medicare, Medicaid, and we want to kind of keep those, but yet we want to experiment with the fact of having more universal care for everyone under one simpler system. How can we move some of the current systems that we have in place, current programs that we have in place, and work those in a way that we can adjust them and test them along the way as if we can actually move to an ultimate goal to something else, rather than having that ultimate goal as a yes or no. We're either going to have universal health care or not have universal health care. We're either going to have Social Security or we're going to do something else to provide financial security for the elderly in the future. We haven't as a country been able to do more. I can't think of another term except transitional policies that move us bit by bit, but we know it's moving us bit by bit to a different.
Right. Well, I mean, one of the things I'll say is, in a way, I think often those things you're describing as transitional policies are the things that end up getting stuck in producing kludges, right? I mean, I'll give you one example of this, something I've actually written about, which is you were in Washington for a long time, so I'm sure you remember Stuart Butler, who was at Heritage, right? And so Stuart was writing all these things back in the 80s, saying that we're going to create, that what we want is to create a Social Security system that'll be private accounts, right? But you couldn't get that initially, right, because of lots of obvious political problems. So we said, well, let's, we're already starting with these 401ks and RAs, so let's keep pushing them, right? Let's just keep increasing these, and eventually they'll be the transitional mechanism to get us to Social Security private accounts, right? Well, of course, what you're describing works if you have a more or less technocratic political system in which someone can actually coordinate this actually, step one turning to step two, turning to step three, which eventually gets you where you're going. But of course, we don't have those coordinating mechanisms, right? And so the danger is that in creating something that was designed to allow you to transition from some existing system, right, what you get is that existing system plus this thing that was like a bridge to nowhere, right? That's the real danger I have with these transition things, is because we don't have the ability for one set of people to commit people later on, right, that whenever you try and do that, right, you try and say, oh, we're going to try and slowly get us from one simple system to another, that the danger is all you get is proliferation of complicated half measures that were designed to get you to something else, but in fact don't. I think that's, again, why there's a good argument for at least finding some deliberative norm, right, to make people think that there really is going to be cost. And sometimes it's going to be hard, and sometimes people are going to have to pay cost to get you from here to there, right? But partially it's that whole effort to smooth things, to get from one system to another, that actually produces all these failed transition mechanisms. So I guess maybe I'm a little suspicious of transition mechanisms, or at least mechanisms that don't have a clear story about how they're actually going to eat away at the thing that's already in existence, right? I mean, I can imagine a system in which, for example, you made it much easier for people to drop out of their employer plan into the exchanges in healthcare, right? So you could basically say, what we want to do is get rid of this employer system, right? That's part of the master kludge of healthcare, right? And that we simply, made it way easier for people to move the subsidy they were getting their employer into the exchange, right? That would encourage employers to drop their health care, or at least drop the actual provision of it and just hand their employees checks that they would then take the exchange, right? The exchange, right, would be a pretty simple way to actually manage if you made these exchanges universal, right? But of course, I don't think there was a clear, I think people had a hope, they had a dream that was what would happen. But a dream or a story, to use your term, a story about how you get from here to there, a story is not a mechanism, right? So I think here you actually need a mechanism that's going to clearly force transition from one system to another, even without people having to do something to update the thing to get you from here to there. So I think that's my danger, is a story is only half of what you need. You also need a very powerful mechanism that doesn't need additional action that gets you from here to there.